We'd like to welcome you to part 3 of Dr. Robert Chandler's webinar series. We're pleased to make an announcement and a note that over 100 people have been following this series. And if you've missed the first 2 sessions of the series, you can certainly go to firestorm.com and you can link to the recordings of the past webinars so that you can get caught up with everybody else. Today, our discussion is going to cover part 3, the incident response phase. We invite you to become our friend at Firestorm Solutions. You can also follow us on Twitter. Firestorm Soul is the Twitter, and there is a hashtag. The hashtag is Crisis Coach. Firestorm transforms crisis into value and empowers you to manage risk and crises. Firestorm expertise is crisis management, critical decision support, crisis communication, crisis public relations, and consequence management. Please keep in mind the presentation today is not complete without the accompanying oral comments and discussion, and the work product provided must be read in conjunction with your organization's personal counsel. In addition, do not interpret this information as legal advice or legal opinion. Our presenters today are Jim Satterfield, who's the president of Firestorm, and we're pleased to have with us again Dr. Robert Chandler. And Jim, over to you to introduce Dr. Chandler, if you would.
Certainly, and I think most everybody on the call today knows Dr. Chandler and has enjoyed sitting through the webinar series and hearing him. He's coming up in speaking next month. For those of you that will find yourself in China, you'll be able to hear him live and in person there. But if you're not traveling to China, you can also hear him live at the DRJ in San Diego at the end of September. And then, of course, the European group can catch him in Austria coming up a little bit later this fall. So, Dr. Chandler, it sounds like you can't stay in one spot with all this.
I've been scolded about that since kindergarten.
There you go. So it's exciting to hear and run. We've been doing a survey on the webinar series with different questions for each one. And today for today's webinar, we did a survey around the role that communications plays in the evaluations that we all get from how we perform. And here's the first result of that. Is communications or communication effectiveness used as an evaluation criteria for routine performance appraisal evaluations? 57% of you said yes, 43% said no, and I would like to call you both wrong at this, both the yeses and nos. If you do have a problem with communications in a crisis, it will certainly be a part of your evaluation. And if you get everything right, I don't know that it will push that needle much higher. Clearly, it will always push the needle lower as we go forward. We went a little bit further with the questions for today's webinar and asked, how is communications or communications effectiveness defined and measured? After action review, it got 58%. You see the supervisor's evaluation, 17, 8 with a standardized tool, and some said a survey questionnaire, and others said communications. But really, when you think about it, the effectiveness is, did we get the behavior that we were looking for? And I think that's going to be very true, Dr. Chandler, as we focus today on this third dimension of crisis communication as we think about it, and that's the response area. We've focused on these 6 that are the phase for us to look at communicating in a crisis. We dealt when the warning comes in, when the risk assessment occurs, and today it's going to be the incident response, which is that item number 3. The next in the series will be management, and then resolution and recovery on the last 2, and I think Bill was correct. This is an important series for you to follow and use, and these webinars can be used for in-house training as we go forward. Before we jump fully into the incident response, Dr. Chandler, do you want to make any observations about this section as we begin, or in particular, the survey that was just done?
Well, I mean, the first question on the survey was really asking whether or not communication is one of the core competencies that is used to evaluate performance. And I would, of course, I mean, I feel like I'm the evangelist here or something for communication, and I guess in some ways I am. I would argue for a real focus on both soft skills and hard skill performance of communication as part of the way that any other type of role is enacted. And I cannot imagine a functional area that doesn't require someone to be an effective communicator. And specifically, if I were being evaluated in any sort of continuity or crisis management or disaster management recovery events, and I got 6 out of 10 times it was after action review that determined whether I was communicating well, and that was part of my evaluation. I would be anxious to do better because my research has indicated that communication is the #1 critical failure area in after-action reviews, and so it would certainly get my attention. But yeah, today we want to continue our process, and I just want to remind everybody that the purpose of looking at 6 stages of a crisis for communication planning is not that these events occur in a, always occur in the same sequence and they'll be distinct events. It really is guiding our planning so that these types of critical communication are being addressed both in our action plan, but also being something that we're monitoring and implementing. And today's focus is on what I call stage 3, which is the incident response phase. And you may have a warning, you may not. You may have a chance to do some threat analysis. We hope you do. We hope you've got your sonar on, your radar on that we talked about last time. But sometimes things just go bang. There's a boom. It happens. And you may not get that advance warning. But this is when the moment, whatever the incident, or at least the trigger incident, the core incident occurs, and your immediate response to it. Those of you who follow ICS or NIMS training, if you've completed the FEMA coursework, you would know this as the activation of your incident action plan, your IAP. If you want, your IC, your incident commander, activates the IAP. And so if you know all that jargon, that overlaps with what we're talking about today. By the way, if you don't know any of that jargon, it doesn't matter. We're talking about the things you do in the moments, perhaps up to the hours, to mobilize and respond and react to some sort of incident. Now, this may not even your team may not even be assembled yet, but you may have a dispatcher or a key point person or head of ops, and maybe your incident commander or your team commander. But basically, once this incident happens, it activates everything that you are prepared to do, and some of it may be automatic. I mean, you may call law enforcement. You may dispatch your own security. You might contact the utility company, the gas company. You may, call the fire department. There's a lot of things that may be going on through built-in, maybe even cybernetic alarms and things. Somebody pulled the fire alarm. There's certain things. But our purpose in this webinar series is to think about our communication planning. So I want to put your mind now in those vital, critical golden period that's after the boom has happened, the incident has occurred, and we need to start planning for everything from those automated responses to the cybernetic responses to notifications, to whether hazmat should be notified, whether law enforcement, our own people. Are we calling for an evacuation? How are we triggering that alarm? How are we communicating it? So anything that would normally be regarded in the ICS model as an incident action plan is what we're looking at, all of the different types of communication. And really, this is the time where your advanced preparation pays off, because you won't have a long time to form a meeting and a committee is put together to decide whether or not to evacuate the building. The fire alarm is in, the smoke is in this location, are you evacuating? And so a lot of this is done in advance. And so,
and Bob, I think when you think about this, we're thinking about environmental health and safety generally as one of the first things that comes in. The incident has occurred, the shelter in place, the evacuate, the lockout, the lockdown, those types of actions that need to activate whoever is responding to the incident that we're seeing and feeling here. As you have up on the screen, the incident action plan, what do we need to do, who's responsible for doing it, what are the resources, and how we communicate.
Exactly, and I guess if this is where the flashy stuff. I mean, it's the active shooter that comes in your building. It's the wildfire that's now consuming one of your warehouses. I mean, those get lots of. And by the way, those are critical, and those are stressful, and those are horrific events that have to be responded to. But these are also the things that or even borderline routine. It's the water main that's broken. It's the utility failures. It's the cyber attack on your IT infrastructure. It's the gas. Somebody smells the odorant put in your natural gas feed, and you're worried about a gas leak. These are the domestic disturbance. Somebody's spouse showed up and there's a big fight going on. These are your incident action plans that range from very isolated events to incredible widespread, Hurricane 9/11, Mississippi Delta River flooding that's completely inundated an entire town. I mean, these are all the kinds of things. And so what we're asking now, we're thinking about, are we prepared to communicate to the right people at the right time in the right way at this instant? And even if we don't have time to form a committee to study this and get back to me in a couple hours, these are things that have to be done quickly. So we're talking about the urgency of immediate needs that have to be addressed. And this involves command and control, coordination. This involves providing instructions, letting people who have responsibilities in advance get them activated. They're now in charge of those responsibilities. It's also a moment in time of adapting your incident action plan, because there'll be something that is unique and unusual about every situation, and so a lot of people just can't work completely off of these scripts. I always use the analogy of navigating a boat. You can chart a navigational path, and you can think, we'll sail for so many minutes at this heading, we'll tack, we'll sail for so many minutes at a different heading. But until you get in the water, until you actually feel the wind, until you know the temperature of the water, how much kelp is clinging to your hull, that all of those things will have to be adjusted mid-course. And I believe the same thing is true. I think you do plan. You would never set sail to the ocean without charting a course. But if you follow the course without ever making course adjustments, then you're not going to get to where you want to go. This is also the time where your personnel have to be monitored. I'm a big believer, by the way, of course, we want to get alerts out and warnings and get the fire department there and get emergency response going. But we also need two-way communication. So once we've called for an evacuation, are we confirming with our fire wardens and each of the floor wardens that people are out, that we've successfully done it? Are we at our assembly points? Are people checking in? Do we have a plan in place for those who were absent that day? The reason they're not checking is they're at home. All of this is there. And the other thing, and I know we talked about this last week during the risk assessment, or last time we met, and Jim, you had some great points, is that the problem of it being both an information desert and an information ocean. Both of those metaphors work, because real, substantial, verified information is hard to come by. It's an information desert. And that information is, there's mirages out there, because you think you know something, and later you turn out you didn't really know it. And then there's, of course, the information ocean, and the information ocean is just that you're going to be drowning in, I'm going to say trivia, but that's really not fair. You're going to be grounding in pseudo-information, and there's so much that you have to sift through, and so you've got to have a system of processing that at the same time. And so incident command is a great idea, and if you follow the official government ICS model, it fits well. It integrates with other agencies, and there's nothing wrong with it. It's authority. It's a military metaphor is how it's run in terms of ranks and whatnot. If you're not, if that doesn't fit for your organization, whatever process you're using, that has to be put into place, and all of it. I don't know how you respond to an incident without communicating effectively. To me, communication is not a part of doing it well. Communication is how you do it. And how well you communicate is how well that you respond to an incident. And I think it's, yeah, go ahead, Jim.
When I look at the last bullet that you've got on this page, and then we'll move on, It says these tasks require extensive set of communications procedures, messages, active channels, and modalities, and well-prepared personnel. Of all of the cycles of crisis communications, this particular phase, the incident response, I think lends itself to the most advanced planning and the most structured because it's easier to edit than it is to create a message. In your opinion, is this the area that should be well mapped out in advance?
Right, I do believe that. I think that if you don't have procedures spelled out for how we're going to handle this situation, trying to write them on the back of an envelope in the middle of an event is a horrible timing. If you don't have templates, I suggest you map out messages. Yes, you will have to adapt them. I mean, you never run them blindly. I mean, if there's this, it's like an evacuation plan. It may very well be that the fire is in a unique situation that evacuation assembly point 3 is no longer an option. I wouldn't send people blindly down a corridor to assembly point 3. And you're going to have to get that information, make those judgments. I think the big thing here is that you're not going to have a lot of time. Most of these things that happen in the incident response phase are things you better have well scripted. And if you're going to ad lib, well, okay, I suppose there are capable people who can ad lib and what is it called when the comedians do it? Improv. I suppose there are people who have great ability to pull off flawless improv. I'm not recommending that. I'm agreeing with your point that I think this is one of those cases where if we're going to do a little ad-libbing, let's do it off of a well-rehearsed, a well-prepared script with a well-rehearsed cast of key I was going to say key characters, although in your company that might fit key characters, but a well-rehearsed group of your team members. This should not be Comedy Central. This should really be, I don't know, there's some metaphor lurking there, Shakespearean or something. This is also the time, by the way, when a lot of the technology that's out there is available. And I've worked with a number of these different vendors that provide incident notification solutions, dashboards, feedback, situational monitoring, and those are incredible tools. And so incident response is one of, and by the way, it's not limited to that, but it's one that, and I think many of our minds gets tied to some of these tools, and I think the tools are great. What you really need, though, is to have the concepts, the strategies, and tactics. Obviously, the tools are helpful, but they don't provide you those concept strategies and tactics. And so what you want to do is provide that notification to your key responders, to your key stakeholders, and of course to people who are in harm's way. And we should do a whole separate webinar sometime just on warnings and how people react to warnings and how people don't react to warnings. And warning messages are their own thing, and they can be quite challenging. In this case, though, if we look at the incident response phase, what we ought to do is take the tools, the templates, the techniques, and then the principles that I'm talking about, and we should be able to plan for communication for a variety of different kind of situations. Now, I know that the FEMA folks are big on all hazards preparation, and I tend to be a little modified from that. I think you should find common hazards, like focus in on the kind of response where you would evacuate. And what are variations on a theme? Let's do a little jazz with this. Let's get our basic evacuation plan down, and then let's do some blue, purple, green, and red plans that might deal with maybe the freight car full of chlorine derailed at one of our evacuation sites. So we're going to shift it. We're going to play this differently today. But I do think that we take all of our tools and our technology, and we get our information that we can process it quickly. The problem is that this has got to happen very, very, you have to be thoroughly prepared because you're going to have to implement this quickly. That's probably one of my biggest takeaways that I want you to do is that a well-rehearsed plan would take all of these. So, do all of the variations of evacuation, do variations on shelter in place, do variations on schedule and shift changes, do variations on lockdown, as you mentioned, if you've got a facility. I also think as you prepare in advance, I teach this. that I think you have to develop a series of message templates and work from those. And the reason is that you want to get some of the trickier wording and those things sorted out in advance. You want to be able to work them and revise them and make them simple. You want to give people some advance notice of what kind of a message you would be sending and what it means, and do that well in advance. You don't need to explain it. You ought to be able to have it connect with what's in people's heads. You can also test the messages and keep them very simple. What's the old acronym? KISS, keep it simple, Sam, keep it simple, stupid, whatever it was. And you should develop these things. I also think that it's really advantageous to get your lawyers in, to get your senior management in, get the senior administrators in, because anybody that's got an issue like, why did you word that word, why did you call our people victims, they're not victims, they're survivors, you know what, get all of that done in advance. You know, if you're having an argument in a hallway about whether you refer to your employees as victims or survivors, you really but you're really ill-prepared. You've been caught with your proverbial pants down. I really think those kind of issues should also be vetted in advance. Go have the discussions. You say, well, should we release this information? Does it comply with our policy? Well, some of you have rules to follow. And you know, in the universities we have FERPA, healthcare has HIPAA. You've got a number of different regulations, but a lot of it is, you know, should we have, you know, and so you got to have your information policy done in advance. So I suggest you map messages out. You have talking points. You have bullet points. It's also a checklist and a roadmap. You know, when they teach pilots how to handle situations in a cockpit, they don't tell them to memorize everything they need to do. They give them a checklist. They give them a procedure manual that says, when XYZ happens, let's flip over to page 137 and let's go down the checklist. Here's how we restart the engine or whatever. And there's a lot of psychological reasons and systems reasons why we do that. It's also true in this situation. I also think, though, that sometimes you're not going to have a chance and you've just got to have some stuff ready to roll. Seconds matter. Minutes matter. There is an urgency for this phase that is earnestly serious, and I think that's something that needs to be part of that. And I would say so, Jim.
And Bob, just to jump in a couple of things, I think of all of crisis communications, while speed is important, and in many cases speed is quality, getting the right message to the right person at the right time. In the immediate incident response, getting that message out so that because time and access become critical elements associated with that. So it's not enough just to craft your messages out, but as Bob pointed out, and as Dr. Chandler looks at these individual areas, it's getting management buy-in that it's okay for the message to go now. There's a game that we all played when we were children called Mother May I. May I take a giant step or a baby step or whatever to come together? We see communications break down at that point of, should the message go out now or later? Because in this area, time is such a critical element, and that needs to be a part of your plan, just like writing the messages. And if management wants approval, then there should be a channel that approval will be given instantly. To evacuate after the building is fully engulfed in flames is obviously not as good as getting out before that in fact occurs. So it's really this coordination and to notify of the emergency response with all the parties that are involved.
Right. I mean, getting the information out too soon, people ignore it. Getting out too late, they get, it's ironic, it's ridiculed. And I think part of this is this is one of the most challenging things. This is one of the things that turns your hair gray as you begin to think about, you know, the information's not reliable, it's happening too quick. I do agree with you, though. You know, if you don't have an information release vetting policy in place, you really need to spend some time doing that. Having parameters, having guidelines, having guidance from your management about what information is appropriate, which is not. By the way, when you do tabletop exercises, when you run drills, if you do a mock, you know, you need to begin to see and specifically debrief and focus on things like, well, is this the right information. Should we be releasing this? Is this appropriate? Is this legal? Is this upsetting our employees? Does this upset somebody? You need to look at it from a an accuracy standpoint. You need to look at it from a messaging standpoint. I really think, I don't want to go too fast over this because I think it's such a deep point that has to sink in, is that you won't get a lot of time in the moment of the event to really reflect on the implication and the consequences, unforeseen and foreseen. And so I'm suggesting you do that in advance, that you spend some quality time thinking through. Does it make a difference how we say it? Does it make a difference what kind of subject heading we put on it? Have we trained our people to recognize urgent messages from vital messages, and is that distinction important in your context? Yeah, I've got lots of research. I've got research on subject lines. I've got research on wording, and there's so many variables here, and I don't think you can wait and do it as an improv.
Well, one other comment I would like just to jump in on is to have everybody stop and think, what's our message strategy if we sent out the wrong message? The wrong at that time, or in fact the wrong message. Several years ago there was a college where they had a fire in the chemistry building, and they used the notification system and they sent out the message to evacuate now. Someone then recognized that the message went to the entire campus. And so they said, uh-oh, what do we do? And they said, well, to send out a message to ignore previous message. So they did. But then they said, well, what about the people in the chemistry building? So they sent out a second message that said, ignore previous message. And so that confusion didn't serve anyone's interest well. So how you notify if, in fact, you made the wrong message can certainly be one that most people don't stop and think through. Now, you've mentioned this golden minutes and golden hours. Can you expand a little bit on that for us, Dr. Trent?
Well, the metaphor, as I think everybody knows, the metaphor is taken from the healthcare context, that when there's a serious injury or something, that as the systems in the body react and shut down and cease to function and things happen, is that you often have this very special window to do something, to intervene, to stop the bleeding, to restart the heart, to get blood and oxygen to the brain. I mean, you've got this window. And so this is borrowing the metaphor that in terms of your crisis situation, the first steps you take if you're prepared to intervene and do, I don't know, do emergency first aid or whatever the metaphor would suggest, is that you've got the best opportunity to respond promptly, accurately, effectively in order to stop the bleeding, if you will, in order to stop this thing from becoming worse. If you can, after the storm passes, if you can intervene quick enough to get the levees to hold, that's better than letting the levees fail, which creates a cascade failure. If you can act quick enough to keep the earthquake and keep the tsunami water out of the containment zone, I mean, you've got a chance to do something early in an event that perhaps stops it from completely becoming a catastrophic disaster situation. And I think that's what the incident response phase is all about. That's what an incident action plan is about. That's why communicating effectively and being prepared to get in touch with people and do it. And so this is a phrase that gets used a lot, but you got to connect with people, and at the right time, you got to find them. You got to have your databases up to date. You've got to have them prepared to understand why you're contacting them with this message, and the message itself needs to be carefully constructed and effectively written, and it needs to get to them in the right time, in the right way, and the why, the right reason has to be there. And it's a whole variety of things. So when we go through communication planning, if I walk through the 6 stages and I work with the team, one of the things we like to put on the whiteboard about this point is I get the group itself to tell me who are their key constituents. Who are we talking about in this type of hazard? We're going to have to, close the facility for whatever reason, structural failure, gas leak, pandemic, hazmat, whatever the reason is. I say, who would we need to get in touch with? Is it the inbound shift? Is it our suppliers? Is it our delivery service? Does this affect the local school dismissal times? Does the street closures involve contact? What about if there's, unless we draw rings around it, so if we've got people who are ill and we're in touch with rescue services, emergency services, hospital, what's the surge capacity? I mean, you build these consistent rings out. Now, you can't notify all of them in the first 30 seconds, although I think there's some vendors who claim their tools are so great you probably could try. But the key is that you've got to build some priorities. You're going to have to prioritize some of this and what happens first and second. You also have to designate responsibilities. And I'm a very strong advocate for someone being responsible for all of the critical functions. They don't just happen. And it shouldn't be one person responsible for all. And so, if you're dealing with just the information policy, who's updating the website, and by the way, I'm not sure in the first moments of a bomb going off in your building, I'd worry about the website. That may come in a subsequent phase. But certainly in terms of how you're notifying people and contacting is very much. The other thing, of course, is we're back to that whole information dilemma. You have got both the desert and the mirages as well as an ocean, and if you don't have a procedure in place, your phone's going to be ringing, your text messages is going off, you've got inbound email, you may have television set covering local news of your the flood waters as they surround your facility. You've got to have a policy in place, and that's another thing. In the first two webinars, I talked about having an active radar and sonar for monitoring information and risk and threats. That certainly doesn't go away. It is a critical task that will continue right on through the incident response phase. But if you've got, if suddenly the whatever it is, somebody's posting to internet that they're inspired by the active shooter in your building, they want to come join them. I mean, those are things that you've got to be aware of. How are you getting information? How are you processing it? What are you doing with reports and rumors and threats? And what are you doing with the new updates on the weather forecast or whatever it might be? And I think having that awareness, monitor and verify, because again, we're dealing with an information desert with mirages and things will change, and you're also going to be dealing with just flooding of information that will literally overwhelm you unless you have a way of channeling it, knowing what to quickly keep or what to discard, and to get it used. So many decisions I've seen in after-action reviews that there was a vital piece of information that was left written on a note on a table and it never got involved in the discussion, and that's a very sad, tragic thing to watch in an after-action review.
And this monitor is one of the top, in the top 5 of failures in a disaster crisis, and that's the failure to identify and monitor all threats and risk. If you're not monitoring, if you're not listening, and then looking at particular persons of interest or events as this unfolds, and are the behaviors that you expected happening because of the notification you got, or is there a failure? And that, I guess, that leads us right into the auditing and having a crisis activation matrix in understanding what are the components that would be impacted. What's the difference between an incident and a crisis? You want to elaborate a little bit more here, Dr. Chandler?
Well, let me just, I think some of this is just intuitive, and you have to work through it in your situation. But, I said earlier that some of these are very isolated events. So, a gas leak on the 3rd floor, I don't know, you may not regard that as a major event. It just depends on what's going on that floor, what's going to be disrupted, and business operations and personal safety. And now you've got to reroute people and find out where people are. And once people get to an assembly point, can you verify who's there? What about the people who don't? Evacuation compliance, as we know, is there's some really horrible examples of it out there. What is your plan? And I'm not going to tell you at this point. I'm not going to say, oh, well, a shooting in your hospital ED department is just a minor event that happens almost weekly. Well, that's not for me to tell you that. I have my own opinions, but you have to decide what's a typical incident that we're dealing with, and what's something that is causing us to activate our IAP and activate an incident response. I do think, though, you need to systematically review it, set the triggers, set the tripwires, if you will, and have people thoroughly versed in it. I think you should periodically, systematically review all of your processes and procedures in various common hazard events. And if you can't tell me, if you cannot tell me right offhand what will need to be done, and that's probably a long list, who is responsible for doing it, and that's may or may not be a long list, what resources are needed to do it, and how are we coordinating this, which requires communication, and frankly, how are we providing information about this to people? And you've got to be able to have those steps in place. And if you've got a central security dispatcher and a lot of this falls on their checklist, that's okay. There are multiple ways of doing it. If you've got always a 24/7 incident commander designated, so there's somebody always that has control. If they've got the comm, then very good. They're in charge of it. If you have to assemble a team of people who need to drive in from home or fly back from Bermuda, you have a little more challenge. So I suggest a systematic review. I suggest always revising and updating your plan. I think you should do this. I think every time you exercise your plan, you should go through and look at the procedures. I think every time you do a major test or exercise, you should update your database, you should contact call sheets. I think you should update your responsibility list. People will change. They'll take new positions. There'll be turnover. People will retire, and you're going to have to get new people who understand what they're doing. I'm a big advocate of training backups to backups. I recommend periodically training and leaving all of your first-line people off to the side, or training them concurrently with your second line and your third line. The reality is that you're going to end up with a third-line person involved in this, and when they say, well, I have no idea what's going on here, and it's too late. I think you should review your tools, your techniques, and I think you should test them. And I think stress testing them is very much important to doing it. You said this earlier. I've made this point before. Because incident response is so time-bound, the expectations and demands for communication of activating your people, activating your plan, activating your response, providing incident notification, that I think it depends and hinges on your advanced planning. Advanced planning is important for all the phases. I don't mean to say that, but I really think there's so much of this, you better have it mapped out. You better have a script. You better have it done. What you're not going to have is a lot of time to sit down with a blank piece of paper and a pencil and start answering these questions. Then I hope that you take the time to answer those questions. And frankly, once you get a plan in place, then you have the wonderful privilege of training people and shaping expectations and making them more qualified to enact these things, educating them and making sure they understand the expectations and their responsibilities, their roles, their assignments. And that's for both communicating and listening. And I think to understand it, I think that the people should never see a warning message or an incident notification message for the first time during an incident. People need to be briefed. They need to say, these are the kind of messages we send, and here's what's going on in the background when you get one, and here's what we're expecting you to do when you're notified of this. And it's so much important. So I guess, let me draw this up, and I apologize. I'm rambling on here. This is a very compressed period. I don't know how long the incident response phase is. I call it minutes or hours. When we get into the next phase, it's when we're going to hunker down and lock in for 24/7 to endure an ongoing crisis. But this, we're really talking about being thoroughly prepared for all of your communication and information needs and coordination needs, that you're able to initiate them quickly, coordinate, communicate, and share the information that's vital to coordinating a response. This corresponds to an incident action plan. If you are an ICS devotee, this corresponds to a crisis management plan activation, if you follow that model. Your leadership and professionalism is really going to be reflected in how good of a plan you have. And by the way, longer plans are not necessarily better plans. I think plans need to be practical, and I think you need to have some steps. And and I think that's probably very much. This is also the stage where you have to reach out to others. Maybe it's calling the fire department. Maybe it's notifying emergency rescue. Maybe it's there's just an amazing number of partners, utilities, suppliers, support. What's the plan for notifying them? Who's responsible? What are they responsible for? what resources are needed, what needs to be done, how do we verify it, how do we communicate it, how do we share information. And basically, I think that you ought to be able to answer these questions about any kind of hazard that somebody might pop up. So everything from severe weather, and do it by common hazards, road closures or high absenteeism or health threats or, I don't know, anthrax release in your mailroom. I mean, what's your plan? It comes down to it. And are you prepared? Are you prepared for this fast, functional, and very stressful type of immediate incident response, incident communication, incident notification, whenever the next thing happens? And I think that's really where I'd like to leave the folks that have been sort of joining us today thinking about, is asking yourselves, what are our plans for this incident response phase? How are we going to communicate? Who, what, why, when, where, how, and are we ready?
And I think that leads us back into predict, plan, perform. And as Dr. Chandler spoke us today on the messages that you must communicate in this space, the word immediate or instant comes to mind. The choices become, are we going to stay or are we going to go? That's really what the issue is, and how we communicate that to get the right action at that point in time becomes so very critical. We've talked a lot about the monitoring and staying aware, and so if you would want to know what's going to happen tomorrow, would that be something you'd like? And the answer is yes. And I think that's why all of us who are focusing on where business continuity and emergency response and crisis management is today and the direction of going forward, it's this idea that we have to be able to predict accurately, have the plans in place, they have to be trained and tested to be carried forward. Also, the ability to have access to the information that you need instantly. And so you'll hear us talk more in future webinars and at the DRJ and at other conferences around instant access tools and having the messages out in advance, having the spokespeople trained. Dr. Chandler identified the need to have backups, and do one of your exercises with just the backups to see how the team works through that process. So there are a couple of options that are coming up, and I want to make sure that you're aware of them. On the 26th of August in the morning, we're going to do a virtual exercise for schools. And in the afternoon, on the 26th of August, we're going to do a virtual exercise for businesses. You can put your crisis management team or your incident management team around a conference table at your organization and company and then go through making the decisions, working on the communications, establishing what you're going to monitor, and see how you do relative to other companies around the country. So that event is coming up on the 26th of April, and there is no cost for that event. I would encourage you to assemble your team and use that. If you want to find out how your plans align to standards and best practices, we certainly would be glad to help, or create the intelligence network that we've been talking about with the monitoring that's needed, or even doing training on this. And I'd like to point out, if you haven't brought somebody in like Dr. Chandler to meet with your leadership, to meet with your teams, to understand the urgency and the intricacies, that was hard to say this afternoon, of communications, then it becomes very, very essential that you do, because that alone will send the message that your team and your people are important. You can download the brief from today's workshop, and you can see here, this is stage 3, the incident response guide. You can go there and download that and share that with those in your organization. We also will be recording today's session, so it'll be available for later review or sharing within your organization. If you've got questions, then I would encourage you to contact Firestorm at firestorm.com, and that would be or you can send an email to webinars@firestorm.com, or you can give us a call at 800-321-2219. There's a lot of options.
Karen?
Sure.
Jim?
Please, Karen.
I just want to make a note that you meant August, not April.
And if I said April, I meant August, and I didn't even have any cocktails today before the broadcast. Thank you. Please jump in there. That is August the 26th. If I go back, I think I wrote, yes, I did write down August for those of you it's unusual that anyone ever would listen to exactly what I said, but thank you, Karen, for doing that.
And Jim, we've had a couple of questions about when the next session will be, and you can just check on our website at firestorm.com under Learn. We have our full webinar schedule, and the next session is actually this month on the 20th, and we look for on the 20th. I have to look to make sure that that is absolutely correct. But we have another session this month. You can find that on our webinar calendar.
Yeah, we tried to do this series in a compressed format, so you wouldn't have to do one a month to spread it out over a 6-month period. So Dr. Chandler was very gracious to agree to be able to do that in a compressed way. One other last opportunity, Dr. Chandler will be at the DRJ. He was giving a keynote speech on the Tuesday morning there, and he'll be in the Firestorm booth, and we'd be delighted to look at your crisis communications plan and give you some insights and to help at that point. So if you're planning to make the DRJ event, then I think that's an immediate opportunity that you'll have a chance face-to-face. Well, we've used up our time today, and thank you, Dr. Chandler, for your input. Always valuable, always insightful. Thank you, Karen, for helping keep us focused on August the 26th and not another day. And again, the brief is there for download for everyone. Thanks, everyone. Have a great day. Work on your messages. We look forward to talking to you in the next webinar. Have a great day, everyone. Goodbye.